Hello and welcome to Lok Talks. This is Dr. Lokesh Bhatia. Today in this video, I'll be talking to you about not so very common, but yes, a very serious problem. What happens after a femur fracture? Okay, it's very common with mid-shaft fracture. This is what we'll be talking about today. This is purely a patient and the family education video. Okay, so in a very patient-friendly language I'll be talking about. I will not be using any medical language which one may find it very difficult to understand. So here it goes. So let me make you understand a life-threatening complication of femur fracture, and it is called as Fat Embolism Syndrome. In short, we write on our medical files FES. Okay. As you all know that I'm an orthopedic surgeon practicing orthopedics for the last 30 years, and this channel I talk more on physical, mental, social, emotional and spiritual topics. So today we'll be talking about a very important topic, that is femur fracture and its most dangerous complication, that is fat embolism syndrome. Okay, so this video is specially made for patients and the families so that you can understand the warning signs and act on time. Okay, so let me give you a brief background about it. The femur, our thigh bone, is the largest and the strongest bone in the body. But when this bone breaks, it's not just a fracture, it can sometimes lead to a serious life-threatening complication, and the most dangerous amongst them is fat embolism syndrome. We call it FES. Okay. So what is fat embolism syndrome? Inside the femur bone, there is a fatty marrow. When the bone breaks, tiny fat droplets can escape into the bloodstream, and these fat particles travel through blood and may block blood vessels. When this happens, vital organs like lungs, brain, skin are affected. So it is a life-endangering complications. Let's understand on the lungs. The lungs are most commonly affected. Patients may suddenly develop breathlessness, chest pain, low oxygen. In severe cases, it can lead to acute respiratory distress syndrome. We call it ARDS, which is a life-threatening problem. Then comes the neurologic, that is the brain. The brain may also get affected. The patients may become restless, confused, drowsy, and sometimes the seizure or even a coma can occur. Then it comes to skin. One special sign is a petechial rash, tiny red spots on the chest, neck and shoulder. If you ever notice this after a fracture, it is a warning sign that patient is developing FES. So what are other warning signs? Watch for patients and the family members. Here are the red signals or the red flags: difficulty in breathing, bluish lips or low oxygen, fever with confusion or agitation, small red spots on the chest and neck. Chest or neck can have red spots. So these are the signs that appears, and treat it as an emergency and reach hospital immediately. Okay. Then let's talk about prevention. The best way to reduce the risk is to do early surgery to fix the femur fracture. Okay. Adequate fluids and oxygen support in the hospital. Careful monitoring in ICU for the high risk cases. What can be the possible treatment? There is no magic drug that cures fat embolism syndrome. Number one point to be very clear. Treatment is supportive, giving oxygen, ventilatory support if needed, and IV fluids and nutrition, but with timely medical care, most patients do recover very well. Okay. So let me conclude what all I have said so far, and there will be some takeaway points. So friends, remember this: a femur fracture is not a minor injury. Fat embolism syndrome is a life-threatening complication, but early detection and timely hospital care can save lives. So always be alert and never ignore the warning signs. Okay? So take care, and hope this video is helpful to your improving your understanding the risk of a femur fracture and the fat embolism syndrome. If you have found it useful, please like, share and subscribe Lok Talks channel so that more and more patients and the families can be aware and be safe. Stay healthy, stay safe. Hare Krishna.